Good morning. It is Wednesday, the 25th of March, and welcome to our daily COVID-19 task force meeting. We're going to start over here on the board. This is day 8 of our self-imposed quarantine. It's a 15-day quarantine, which is going to take us through the end of March. Although you may have heard that the president is now talking about extending the nationwide quarantine through April 12th, which is Easter Sunday. So here's where we are today, and I want to talk a little bit about what the government is attempting to do. You've probably read in the papers, the process is called flattening the curve. And what they're trying to do is take the COVID-19 bell curve and flatten it along this green line to limit the number of cases and the severity. And the process is through self-isolation. The infected and ill are isolated and kept away from society, allowing those who are recovering and the well to flatten the curve and get out ahead of the process. This is a tough process, and you probably heard the president the other night talking about making sure that the cure wasn't worse than the actual diagnosis. I know it's difficult. We're all going a little stir crazy. You're stuck in your apartment. It's very stressful. You want to get outside. You want to engage with neighbors and friends and family. But in order for us to be successful, this is what we're going to have to do. Practice self-isolation. Over 50% of the country at this point is under lockdown. The state of Florida has still not gone to that level. Their restaurants, bars, gyms, pools are closed down, but they are still allowing some personal freedom and some individual movement. We're not yet on a total lockdown. I want to come over and go back to our maps, and we'll start with where we were last Friday. This is the map from last Friday. This is the map from last Friday, the one we last looked at. You can see the population center of San Francisco, Seattle, a little happening down here in New Orleans. Most of the activity is up here along the eastern seaboard. There's been a pretty significant change in last week's map and the map today. I want you to look right in here at the center of the country, and now let's switch down to see what's happening today. Look at the significant increase in the virus, the number of cases as this begins to spread out and fill in the rest of the country. You can see the entire eastern seaboard in mid-America to the east of the Mississippi has now pretty much broken out, and the western states are beginning to experience the spread as well. The other thing that I wanted to mention that I thought was significant, you can see this is probably the spike has doubled, maybe even tripled. So the question becomes, is this self-quarantine working? I mean, if you look at the numbers, there's been a pretty dramatic increase. People are beginning to say, is self-isolation the answer? Is it having an effect? And this is what we're hearing in our discussions with the authorities, is that the reason for the spike is not a significant number of increased cases, but in fact, it's the testing ability that has just now come online. Many of these people maybe had the disease prior to having tests available. Now that tests are out in the community and they are testing more than 75,000 people a day, there is a backlog of cases that previously would have tested positive for the disease that are just now coming online. And what the health experts are predicting is once we get through this backlog, then we will start to see the day-to-day progression of the disease, where they can count the number of infected and the number of fatalities and track it in a 24-hour time frame. That's going to give us our first true look at the extent of the spread and how rapidly it's occurring. Okay, let's go through the statistics and see where we actually are. Across the United States, we're at 55,000 cases and 802 deaths. That number doubled. Number of deaths across the United States doubled in the last 36 to 48 hours. Nearly 60% of all the new cases coming in are coming in out of New York City, which is now a hot spot, and it's consuming a lot of the government's time and resources trying to get a handle on that. Governor DeSantis has told our friends from New York to stay in New York and not come south. So I think that's probably a good practice. Here in Pinellas County, we have 45 reported cases, and we reported our first death yesterday. It was a 67-year-old individual who had not traveled, so it was acquired locally. In Hillsborough County, they are up to 95 cases. That continues to be an adjacent county with the highest spike of numbers. Hillsborough yesterday announced that they are going on a total lockdown, and you'll not be able to travel into or about Hillsborough County unless you are an essential healthcare worker, a first responder, or have a reason to be out and about, like going to a physician's office. In Pasco County, the numbers are 16, so they continue to look really good. That brings the total number of cases in Florida to 1,467, and there have been 20 deaths. Here's one of the really pieces of good news that we're able to share is initially they had talked about a morbidity rate of 3, 4, even 5%. If you look at the mortality rates here in the state of Florida, it's about 0.73%. So it's very similar to what we would experience with the flu. It does still mean that those over 80 are in a high risk category. And so we want to make sure that we continue to exercise good judgment and safe precautions, practice social distancing, and make sure that our residents are safe. Okay, I'm going to flip over to Leslie and ask her to give us an update on our community numbers.
So currently for residents under quarantine, we do have 9, and staff members, we do have 2 under quarantine. For residents being tested for COVID-19, we do have 1, as well as 1 employee. For others that are experiencing symptoms, it is a total of 4 residents and a total of 2 employees. And currently we have no confirmed COVID-19 cases with resident or staff.
All right, thank you. In our visitation and staff policy, there's just a couple of updates. We are still allowing only essential healthcare providers in IL. We are completely shut down in assisted living or skilled nursing unless it is an end-of-life issue. Our entry points in the skilled nursing are limited to the front door. In the independent living buildings, we still are allowing access through the side doors at this point, but it's with the stipulation that if you're coming back from outside, the expectation is that you come and check in and have your temperature monitored. Yesterday, we did make the decision to close the fitness center. Governor DeSantis and the Florida Healthcare Task Force made that recommendation across the state. It actually was an executive order, and so we are now in compliance with that rule and regulation. And so that's our update there. I'm going to go to HR And Sandra, if you could give us an update, please.
Yes. So we're continuing to limit the amount of people coming into campus, and we continue to screen our associates on a daily basis with their temperature. We are actually in the process of adding additional questions to be asked of associates when they are coming to work. We're going to include whether or not they have traveled within 14 days or been in contact with anyone that has traveled. Additionally, if they've been in contact with anyone that currently has COVID-19 or has been tested for COVID-19, as well as if they're exhibiting any symptoms such as cough, shortness of breath, chills, etc. And then at that time, their temperature will be taken. So we'll continue to monitor that fairly closely and work from there.
All right, thank you so much. We don't have much of an update from dining services. We did receive almost 1,200 MREs. Those are the military meals that are ready to cook off if we need them. That's a last resort. Housekeeping, Jesse has added weekly commode cleaning to the schedule, if that is something you are interested in. So on the days that they are changing the linen and making your bed, if you also would like to have your commodes cleaned, we are going to be offering that service. It's a limited service. It is not a full bathroom clean where we're going to do all surfaces, including the floor. It's simply coming in and helping to make sure that the commodes are sanitized and that they are safe. We are still on housekeeping precautions, and so your regular housekeeping services will not be available. Let's go to Tiffany for an update on what's happening in activities.
Thank you, Brent. You'll probably notice today that we are passing out snacks for the midday movie. We're really looking to figure out different ways that we can still keep our residents engaged and active right now. So we hope that you enjoy those snacks, as well as figuring out a way to do virtual bingo so that we can still enjoy that on Monday afternoon, as well as doing our scavenger hunts that you will find in the mailboxes throughout the week. Thank you.
Okay, Tiffany, thank you for the update. The last thing we wanted to cover this morning was just to update you on supplies. Continues to be a challenge for us, sourcing and keeping up to date on supplies. We can report that we have received 15 cases of toilet paper. So that seems to be the one commodity that's really hard to come by. We have found a source of N95 masks, the ones that are actually recommended by CDC, and have been able to order a case of 500. Those should be here the first week of April. We've found a couple of the external laser thermometers to replace the temporal touch thermometers that we're currently using. And it's just requiring a real creative, persistent approach, looking outside the bounds, including new vendors, to try to aggressively go out and find supplies. One of the areas where we've really struggled is we are just about completely out of gowns, and personal protective devices are really important, particularly in our skilled nursing center. And our administrative team came up with a very clever idea that I wanted to share with you. Lauren, maybe you could tell us about this best practice and share a little.
Certainly. So they came up with a creative idea, since we were not able to find the gowns that are typically used in situations like this. These are actually Halloween costumes that are gowns and caps. The polyester count, it makes it easily a product that can be sanitized, and the polyester count has been approved by the CDC, and we've gone ahead and ordered 200 of these. So we are trying to keep ahead with creative and innovative ideas of keeping everyone safe.
So Tiffany, next Halloween, the entire staff is coming as surgeons. We're already prepared. So that's everything we have for you today. Thank you so much to each and every one of our residents for your patience, your understanding in very trying and difficult times. I appreciate your efforts. I know how tough it is. Please continue to practice safe distancing and be safe out there.